All right, so I'm just looking at the MAR. I reviewed the MAR, and I see that my patient has medications that are due at 7 o'clock. So we're going to go to the med station, and we're going to do our first med check and draw up everything and grab our meds. So now we're here. You can see on our MAR that he needs normal saline at 7 o'clock. So we would grab that. That's already in the room, as well as we would grab dexamethasone. So we're just going to check here. We have the right med, and as well, we would also grab levofloxacin, and that's already in the room, like I said. So here, I'm doing my first med check, and I'm checking for the right patient, the right med, the right dose, the right route, the right time, the right reason, right to refuse, right expiration date, as well as no allergies. And we know they do have penicillin allergy, but this is going to be no problem for us today. So now I'm looking on the MAR, and seeing that we need dexamethasone 10 milligrams IV, and here we have 20 milligrams per 5 milliliters, so we are just going to get 2.5 milliliters. So I'm going to scrub for 15 to 30 seconds, as well as at this. Then I would draw up the air, and I'm going to get 2.5 milliliters of air. Oh. Then we're going to draw this up here. And I'm going to draw a little extra because there's a little air bubble at the top, so I'm just going to push that back out. Now we're just checking for any air bubbles, which I don't see any, and we have 2.5 milliliters drawn up. And I'm going to recap the needle against the hard surface. Alright, so now I'm also bringing a flush before we give our dexamethasone, as well as I will bring this, and since I did this outside the room, I can bring this and I will label my syringe. So now I'm going to take all this stuff as well as the MAR, and we're going to go into the room. Hi, my name's Connor. I'm going to be your nurse today. Can I get your name and date of birth? Perfect, and I'll provide some privacy as well as wash my hands. So today I got 3 medications for you. I have your dexamethasone, as well as I have some maintenance fluid, some normal saline, and lastly I have some levofloxacin. So now I'm just going to do my second medication check on the MAR. So I'm checking, I brought in our dexamethasone, and I'm just rechecking to make sure that we do need 2.5 milliliters, which we have. And I'm checking the bag. It's 500 milliliters of sodium chloride or normal saline, and I see that on here. As well as we have levofloxacin here, 500 milligrams. So everything looks good. So what I have here today, I have your dexamethasone, and I'm just going to put this right here. I'm going to flush it first, and then I'm going to give you your meds, and this is for your inflammation. And then we have your normal saline up here. This is for maintenance fluid as well. And lastly, we have your levofloxacin, and this is your antibiotic to help with your infection. So now I'm just going to open this up, and I'm just going to scrub this top. I'll do this for 15 to 30 seconds, as well as I'll scrub this top, 15 to 30 seconds as well. Now this is just make sure I'm flushing the tube, and I would give about 3 milliliters. Now I'll take this off. I'm going to grab, now this is your dexamethasone here. I'm just going to scrub the top of this, as well as this. Now when I give this, I'm going to be giving it at about 1 ml a minute, and while I'm doing this, I'm checking the vein for any infiltration. Just make sure that nothing's getting outside of the vein, and I would push this, like I said, over 1 ml a minute. So I'm just going to give it slow, but I'm just verbalizing this for this. So I would give this as well. Then I would take this off, and I'm going to re-scrub this and just flush it again at the same rate that I gave the dexamethasone. So about 1 ml a minute again. Now I would give 3 milliliters.
Your fluids up, and then your levofloxacin for
Alright.
antibiotics for your.
Now, I'm just going to clean this back, put this on. Now I'm just going to hook up your maintenance fluid and your levofloxacin for you. Since it's already in the machine, I'm just going to scrub this and insert it. Alright, and I'm making sure that this roller clamp is closed as well. I'm going to turn on the machine here. And I'm saying, yes, this is a new patient. So I'm going to click on Med-Surg, and we're putting in our IV. So I'm going to put IV. All right, and then we know this is maintenance fluid. So I'm going to click on that. And here we have 500 milliliters. And on the MAR here, it says that we are giving it at right here, 50 milliliters per hour. So that's what I'm going to program into the machine here. And I'm going to put it for 480, even though this bag is 500, and this is just to make sure that it doesn't run dry. So then I'm going to make sure I open this roller clamp. I'm going to push run. Just making sure that there's no kinks in our tubing here. And we're noticing that we see that it's starting to drip. So I'm actually going to stop it because we have to add another secondary bag. So I'm going to review and then add a secondary bag, and we're adding levofloxacin. So I'm going to type in that. And then this bag we know is 500 milligrams. And this is programmed into the machine, so we can just confirm that this is the size. And this is already in here, so I can just push OK.
Honestly, your pep talk before really got me through that.
And now
But like, I was
like, call back at the end. We're gonna say yes, so it tells us to come back. And we're going to now plug this in here. We haven't pushed start yet.
Blanked out. Oh, like a minute after inspection.
Yeah.
And like he's like, I'm so proud of you guys for like being able to cover.
Oh, good.
Now we're opening this.
I don't know if you didn't.
Now we can push start.
No.
Oh. Of course, that's what you read.
No worries.
And before we do that, we have to make sure that this bag is lower, so then this will start dripping. As soon as we bring this down, this started dripping. And then we know that now this is going to infuse, and then this bag will start to infuse after that. So now that we have everything ready, I would pick up all my items and I will leave our patient in a very comfortable position. I will document on the board.